Hi guys, welcome back to my channel. This is your girl Ndukachinaza Favor. So if this is your first time seeing my face, that's my name. Thank you so much for clicking on my video. Yeah, and please do not forget to subscribe, like my video and comment before leaving this channel. And if this is not your first time, thank you so much for coming back to watch my video. Guys, by the title of this video, you already know what I'm about to talk about. So this is what I wanted to know when I wanted to start nursing school. Like, I was so curious. I was like, oh my god, hope there is no maths, because me and maths, anything numbers, like, counts me out, you get. So like, I was really curious to know like what is going to be taught in my first year of nursing school. And guys, if I saw this video, like, it would have been helpful to me. But now I did not see the video. So now, if you're planning to come into nursing school and you want to know what they're going to be teaching you in your first year in nursing school, please stay to the end of this video, because in this video I'm about to tell you like everything that they're going to teach you in your first year in school of nursing. So guys, the first one is your chemistry and your physics. Guys, you see chemistry and physics here, do not joke with it. Your secondary school chemistry and physics, especially the WAEC and JAMB past questions, please do not throw them away. Like, study it very well, because most of them actually come out in the PTS exam. So guys, the chemistry and your physics is very important, because you are still going to continue. Though sometimes they end up teaching you like chemistry and physics that's being related to nursing. That's like how to operate like nursing equipment, you know, stuff like that. How to know how to combine drugs so that it will not react to so that it will not be a disaster when you administer the drug to the patient, you know, stuff like that. So it's basically like what is being related to nursing, chemistry and physics that is being related to nursing. But why I'm telling you not to throw away your physics and chemistry past question is because, see guys, they will teach you all those things, but trust me, during exam or during the period of exam, when you have your chemistry and your physics questions, you realize that 70 to 80% of the questions are what you are being taught in your secondary school. From your SS1, SS2, SS3, those are the questions you are going to be seeing in your question paper. So guys, do not throw away your chemistry and your physics past question. Very important. Trust me, you will need it. And guys, the next one I'm going to be talking about in this video is your anatomy and physiology. Guys, anatomy and physiology. It's basically not really hard, because they're just getting into the system, so they're just introducing it to you. So they're teaching you the simple things. So for my school, we are being taught like 3 systems, which is the musculoskeletal system, lymphatic system, but being taught blood. Yeah, we're being taught blood, components of blood, white blood, red blood, you know, stuff like that. Then we are being taught what else? Bones. Bones is musculoskeletal, so it's like muscle and bones, you get. So we are being taught heart. Thank you very much. Heart, cardiovascular system, heart. So these are really like introduction to the anatomy itself. So it's like you have to know like the bones, the names of the bones in your body, like the femoral bone, the tibia, the fibula, the humerus, everything, and their description. You need to know how to describe a bone, like long bone, short bone. You need to know how to describe like a bone. There's a way that there's a way that bones are being described, so you really need to learn it. The scapular bone, in fact, you just have to learn all the bones of the body, types of bones, everything about skeleton. Then blood, you have to know then blood cells and all that. So anatomy is actually broad, like very broad. So you have to know all these things in anatomy. Then we don't do maths. Good news. People like me, that me and maths, we are not close, we are not friends at all, we are enemies. So like, I was so happy that we did not do maths, but most of like the physics is maths, like calculations, but like they're not like serious maths like that, like the deep maths, for that maths, no, you don't do that. So physics is maths, but not really maths. It's still maths, sha. Yeah. So another one I'm going to talk about physics, chemistry, anatomy, sociology. Guys, I love sociology. If you know me well, you know that sociology is what I wanted to study in the university. Yeah, that's what I wanted to study right from time. So we are being taught sociology in the university, but I didn't even give me that in the university. I just choosing like a course. I was not even prepared for what I wanted to do. I was just like, I beg, let me just get out of this house, you get. So I was like, okay, sociology, because I learned that sociology, you can work anywhere, like any company of your choice. So I was like, okay, let me just go for sociology. So my mind was not there, but yeah, I really love sociology. I fell in love with the course because I started reading the course and all that. So sociology is being taught there just to know about the cultures of people and how to interact with your patient, how to know how your patient is feeling. It's basically just interaction. What's sociology? Sociology is the interaction between man and his environment. So sociology is like how you interact with your patient, how to understand what your patient is doing, how to understand what your patient is saying from a patient's perspective, you get. So it's like just basically relating with your patient. So sociology is actually very easy, to be honest. For me though, it's easy. Then another one I talked about is we talked about English, basically, like just the basic things about English. English, I don't know why. This is not a good thing, but I have never read before an English exam. That's the truth. It's not like I know English like perfectly well, but I'm like, what am I going to read? Is it not simple things? Like that's me though, but it's not good. So basically, you have to read your English. So yeah, English is just the basic things now. Words and opposites, just so that they will know that you know how to speak English. You get. Another one is your nutrition. Nutrition is basically carbohydrate. You don't have to know the classes of food: carbohydrate, protein, fat, lipid, vitamins, types of vitamins, types of vitamins. Then you have to know how they are being digested in the body. Digestion of carbohydrates starts from the mouth. Digestion of protein starts from the stomach. Digestion of fat and oil starts from the small intestine. So you really basically have to know like things like that: the digestion, the what it contains, the food, the nutrient it contains, budgeting in and this thing, family budgeting, basic stuff like that, and how to give like the right nutritious food to your patient, like how to administer, or nurses are being their one part of their job is part of their job or duty is to tell the patient what to eat to be able to recover fast and all that. So like just that. Then we have like ICT, basically types, software, hardware. It's not even hard. Software, hardware is what you did in your secondary school. So it's just software, hardware, application, software, application, all those programming stuff. So it's not that difficult. So ICT is not difficult. Then the last but not the least though, this one is not the least. I'm supposed to I'm supposed to have talked about this one since. Foundation of nursing. Foundation of nursing, hey God, is broad, guy. Foundation of nursing is broad. Like foundation of nursing is like this, like this. So when you are reading it, when I was reading for foundation of nursing, guys, I did not even know where to read, because I have been reading foundation of nursing since, but it's as if I've not read anything. That is to tell you how bulky it is. It is very, very bulky. So foundation of nursing is being done in your first year of nursing school. And this foundation of nursing is just talking about the history of nursing currently, history of nursing and nursing currently, and nursing and midwifery council. Basically talking about stuff like how is things too in your things that you are going to see in your word posting and all that. Then we have first aid by the side. It's like a side of foundation of nursing. That one is about how to take care of your patient, how to administer first aid to your patient. There's all those emergency stuff. So how to administer first aid to your patient, how to give your patient dog bite first aid, snake bite first aid, epilepsy first aid, different things, guys. So that's it for that. So please, guys, if you're coming to school of nursing, or you know someone that's coming to school of nursing, please send my video to them, share my video to them so I can help them. And please do not forget to like my video. And yeah, thank you for watching my video. Thank you. See you in my next video. Bye.